Ladies and gentlemen, thank you for allowing me to present the results of a nationwide analysis on early rehabilitation following laparoscopic liver resection. This is a study from the French Association for Surgery study group. I have no conflict of interest to declare. And as an introduction, we can say that now laparoscopic liver resection is associated with patients' postoperative rehabilitation and better outcomes. And we can rely on many systematic reviews and meta-analysis comparing outcomes between laparoscopic and open liver resections in HCC, but also on a randomized control trial comparing outcomes between laparoscopic and open resection for colorectal liver mets. On the other hand, there's increasing use of difficulty stratification in laparoscopic liver surgery due to the extension of indications, rising consensus and evidence level, and also the need for standardized learning. And one of the scores mostly used in difficulty stratification is the EMM score, which separates three procedure grades, low, intermediate, and high difficulty. And is based on three main parameters, intraoperative parameters, which are operative time, blood loss, and conversion. And this difficulty score has been correlated to morbid mortality. The objective of our study was to create a model integrating the EMM difficulty classification to anticipate the patient's probability of experiencing early rehabilitation following laparoscopic liver resection. So we analyzed data from a nationwide multi-center survey, including all patients undergoing laparoscopic liver resection in 27 French centers between 2000 and 2017. The register included originally more than 4,000 patients. The difficulty of procedure was graded using EMM classification, and factors associated with length of stay and 90-day readmission were assessed using multi-level regressions to disentangle the between centers effect. Patients who had no prolonged hospital stay, less than 7 days cutoff, and no readmission were considered as having experienced early rehabilitation. We performed a variable selection procedure based on random forest to create a predictive model of early rehabilitation. And the performance of the model was assessed and calibrated using precision recall and calibration plots, and also internal validation was performed using bootstrap procedure. So we included overall 3,220 patients, about 40% for liver cancer, about 25% resected for colorectal liver mets, and 34% for benign lesions. Among them, 1,615 patients underwent grade 1 low difficulty procedures, 757 grade 2 intermediate difficulty procedures, and 848 patients underwent high difficulty grade 3 procedure. Median age was 46 years old. Patients had severe fibrosis in about 28% of the cases. And the complication rate was overall 38%, increasing over difficulty grades, of course. Severe complication rates was 7% and mortality rate was about 1%. Median length of stay was 6 days, and 141 patients had readmission to hospital, which corresponds to 4% patients. The factors independently associated with length of stay were patient age, difficulty grade, the major resection, the number of lesions, and the indication for resection, distinguishing primary liver lesions from metastasis or benign lesions. Factors independently associated with readmission were major resection and indication for resection. A total of 1,762 patients, 64% experienced early rehabilitation with a length of stay less than 7 days and no readmission. And so to build the model after random forest selection, we selected 8 variables and retained 5 final variables to build the final model. The 5 final variables were patient age, EMM difficulty grade, major resection, the indication for resection, distinguishing primary from secondary from benign, and fibrosis grade. This model was internally validated with an area under ROC curve of 0.74 and an area under precision recall curve of 0.84, which corresponds to a good calibration. A nomogram was also built and provided. In conclusion, a simple model, including EMM difficulty classification, allows a reliable preoperative identification of ideal candidates for early rehabilitation following laparoscopic liver resection. Thank you for your attention, and I would like to thank all the participants to this register study.